Hey guys, Jimmy in here, the acupuncture guy, the neurology acupuncture specialist, and today is another daily power tips, and today's Tuesday. So Tuesday we're going to talk about Treatment Tuesday. So I'm going to discuss a case that I just recently got today, literally. This patient, she was struggling with numbness and tingling in her hands. And she went out to all the doctors, got some steroids, got some muscle relaxers, NSAIDs, medications that helped a little, but yeah, she still has a tingling and numbness in her hands, and it's starting to affect her job. She's actually starting to lose grip in her hands. And so the number one thing that most people think about is carpal tunnel, right? And she does have some inflammation in her wrist, and she wears a brace. She wears a brace at night. And she still wakes up every morning with tingling and numbness in her hands. So it's not really fixing the problem. The medications aren't fixing the problem. The braces aren't fixing the problem, right? Does she really need surgery? Is that really going to fix the problem? Well, in her situation, just because you have numbness and tingling in your hands does not mean it's only carpal tunnel. She actually had three causes of her hands, three areas where the nerves are getting pinched and causing the numbness and tingling in both of her hands, right? So the three places that you might want to look for, besides, you don't just look at the wrist, okay? The wrist, yes, she does have some carpal tunnel. She does have inflammation in her wrist, and that is one contributing factor. The second contributing factor that I found when I examined her today was that her neck. She was having some cervical impingements. So basically the neck, something in the neck is pinching on the nerves that goes down to her hands, right? Now, she's not feeling the radiation down her hands, but she's feeling the function of her hands. She's losing it, right? The numbness and tingling. And so she had two impingements already that I found. One was in the wrist, the second one was in the neck, and the third place that was pinching on her nerves that was causing her numbness and tingling in her hands was what we call the brachial plexus. So the muscle, these shoulder muscles, if they get tight and tense, they can pinch on this web, the web of nerves that is called the brachial plexus. It's a web of nerves that are like right here in your shoulder, even in your shoulder blade. It's all formed in the shoulder blade, but it affects the nerves that go down to your arms, into your hands, right? So these areas, she was getting impingement here, she was getting impingement in the neck, and she was getting impingement here in the wrist. So those are three areas that that I found that was causing her numbness and tingling. And her numbness and tingling is pretty much constant. And so after today was her first treatment. After the first treatment, actually within 10 seconds, after I inserted the acupuncture pins, within 10 seconds, first it was her right hand. The numbness in her right hand went away. And then I put 10 more pins, acupuncture pins, and then her left numbness and tingling went away. And so I did a few other acupuncture points to address these three main areas to decrease the inflammation, and she left our office with zero numbness and tingling. Okay, so this is important to know. When you're addressing certain parts, there's usually not just one cause. There are usually multiple causes. So you have to make sure you figure out all the causes and then address those causes. Because if you find, if my examination was incorrect and my diagnosis was incorrect in regards to where it's getting pinched, then my treatment would not have produced that instant result. And that's the beauty of acupuncture at Achieve Integrative Health. We use our own acupuncture technique called the QRA, Quick Relief Acupuncture, QRA. It produces instant results for many of our patients, and it helps us, I would say, solidify and validate that what we thought was the cause is actually the true cause. Because when I directly placed the acupuncture pins to address these three main causes, her numbness and tingling in her hands that she's had for 19 years went away, right? So this is one of the beauty of our acupuncture technique, and because I'm a neurology acupuncture specialist, this is what we do every single day, okay? So just as a side tidbit, always look for different areas. Make sure you find the cause. and there's usually multiple causes, especially when it comes to neurological conditions. All right, guys, hopefully this is beneficial. If you know of someone who's suffering from numbness and tingling in their hands, and they're losing function, send them this post, tag them on this post, okay? Comment below, like this post, have them call us, give us a call, reach out to us. We're here to help. We specialize in neurological conditions. We are very good at it, and so send them this post and get them to get this information, because the more impingement that you have, you're cutting off function. And I'm pretty sure people, you don't want the last thing you do is you're driving and then suddenly your arm you just can't feel it, you can't use it anymore, right? That's pretty dangerous, right? So let's not get to that point. All right, guys. So numbness, tingling in the hands or even the feet, but today we're talking about the hands mainly. All right. Jimmy Yen, the acupuncture guy from Achieve Integrative Health, neurology acupuncture specialist. Remember, as always, everything in life is achievable. So let's go out and let's all make it happen.